According to the Registered Nurses Association of Ontario, there needs to be a nursing practitioner for every 120 residents and up to 4 hours of care per resident per day. This introduces hectic work schedules, and I've personally seen this affecting patients such as those living in Baycrest Hospital who have to wait 10 minutes just to get water. According to the Canadian Institute of Health Information, in 2021 to 2022, patients who needed a hospital bed for acute care had to wait an average of 40 hours and has gone up to 49 hours in 2022 to 2023. These problems are only expected to increase. The population pyramid over here shows that there's a large percentage of the population between the ages of 40 to 65. In 10 to 15 years, they will be part of the non-working class of people and will increase the stress on the system further.
Hi, I'm Rupayan.
I'm Jack.
And I'm Sebastian. And these problems are why we decided to create Listenurse, to improve the efficiency of the staff organization of nursing homes and hospitals, to improve the lives of current and future seniors and patients.
Listenurse is an automated system that takes in patient data to optimize the experience for patients and increase the productivity of nurses. This is done through a controller system, an optimized list, a mapping system, an instructional program, and easily accessible patient data in a pager system. Based on their needs, patients are given one of the following controllers: a single button request control, a multi-button system with a task assigned to each button, and a voice recognition system. These instructions are used to provide our nurses and volunteers with clear instructions. Our optimization feature splits duty evenly among workers with regard to time, ensuring the completion of tasks without overworking staff, while considering qualifications of the worker to assign appropriate tasks. Furthermore, through measuring the dimensions of the space, Listenurse mapping system ensures that nurses save the most time through an algorithm that optimizes routing, reducing travel time between rooms and reducing wait time for patients. With Listenurse, nurses can spend their times more productively, leading to a reduced workload and more time to dedicate to each patient's needs.
The algorithm creates a priority queue of tasks, sorted by time in descending order. The program takes the longest task first and checks if any workers have the necessary qualifications. If the worker is able, their workload is updated. After doing this for each task, the script outputs each task assigned to each worker. We had chosen Fortinet as our cybersecurity company. They have multiple years of experience and cater to healthcare and other pharmaceutical companies. The final product will have an Excel-like interface where you can enter important information such as the task name, urgency, optional details, etc. Here's a primitive table demonstrating the output.
Looking at the graph, we can see that the existing competitors, Point-Click Care and Orbita AI, prioritize communication between staff and engagement with family. This is inefficient due to the poorly managed systems in the care environment and lack of instruction to the workers. We instead plan to eliminate those aspects to create an automatic optimization system. We will improve options for patient care and provide clearer instructions to hospital workers while only slightly increasing the production costs. Our soon-to-be markets are current hospitals and senior care homes. Our refusing market is the traditional retirement homes, which prefer the use of personalized care over traditional hospitalized care. Using machine learning algorithms, we can help to get to know more about the patient's personalized routines and add more organization to their schedules accordingly. Retirement homes value personalization of its customers to improve its quality of care, making our product appealing to them. Lastly, unexplored markets include healthcare clinics who schedule by hand and are smaller in size, meaning that they will get to see more short and long-term benefits from our algorithm.
For our ERC chart, we plan to eliminate complex communication programs that are clogging up the system, raise options for patients and instructions for hospital workers, reduce hospital management, and create an automated optimization of tasks and personalized systems for each patient.
We have already pitched our idea to various staff at Baycrest Hospital in North York, Ontario, and received advice from Tony Hain, Manager of Cybersecurity and Corporate Applications at Baycrest Hospital, Raquel Hain, Volunteer Directors of Baycrest Hospital, and Roxana Nagra, the Clinical Manager.
The total costs for the first year is $116,000, while costs for each subsequent year would be approximately $76,000 annually. Given that we are continuing to provide the service online to hospitals, we will implement a subscription of $500 per month per nursing home. This will generate $616,000 of revenue per year with only 5% of nursing homes in Canada, more than enough to cover startup costs. With a potential revenue of $171 million in nursing homes alone per year in Canada and the United States combined, this will help over 1.5 million people receive the care that they deserve. Thank you very much for listening.